Hi viewers, how are you all? Hope you all are doing good. So today I am back with another interesting topic, eating disorders. Yes, you all heard me right. We even don't consider it, right? So today we have Dr. Anitha with us to discuss the importance of this topic, and she is a senior consultant from Kolors Health Care. Hi doctor, how are you?
Hello Sundar, I'm good. How are you?
Yeah, I'm good. So doctor, coming to the very basic question, what are eating disorders?
Eating disorders is actually a mental illness. It has to be taken in a very serious way because that will lead to a very irregular eating habits, and it is also leading to a psychological impact on the person who has eating disorder.
So it is, most of them don't know that this eating is also a disorder. There is this type of disorder. So you say it is really very important to consider it.
Because the person who have the psychiatric eating disorder, they are overly concerned about their body weight and body image.
Okay.
So they will be in a very crash diet pattern. So even this might lead to high in mortality rate as well. That is why.
Okay. So how is this related with weight loss segment?
Um, People who are very much concerned on their body image, their body shaping and all, they will go for a very crash dieting, as I said, right?
Yes.
So they wanted to reduce their weight. In turn, they will go to the extreme level of dieting.
Okay.
So that is why they end up in eating disorder, particularly the age category who are from 12 to 25 years of age, and women, the gender female, will get into more of eating disorder compared to male category.
So why is that so? There is any specific
They
reason?
are concerned about their figure correction, beauty, appearance, everything, but not specifically to say only women. One fifth of the women have eating disorder. At the same time, 1/10 of the men also have eating disorder. So almost it is in 2:1 ratio.
Okay.
If two women have this issue,
Issue?
again one male will have this issue.
Okay.
So that is how this eating disorder goes on.
So what are the different types of eating disorders that we see?
There are several type of eating disorders. The first to say, like anorexia nervosa. It is a condition where people will not eat out of fear that they will gain weight.
Okay.
Okay, so they very little only they'll eat, very less amount of calories they eat. The second type will be bulimia nervosa. It is a kind of condition where they will eat more in one particular time, and the next time they will compensate it. Say for example, they will have a lot of lunch. I mean, the quantity of lunch will be more, but they will cut down the dinner. Breakfast will be heavy, then they will reduce the amount of calories in the lunch, likewise. And some people will have night eating condition. So only during the evenings and during the night they will eat more.
So they will not eat in the daytime.
No. And pika eating, it is a kind of different behavior where instead of food, no, they will eat mud, ice,
Okay.
dirt, like that.
So does this condition really prevail?
Yes, it is actually a psychological disorder.
Okay.
Eating disorder is majorly into psychiatry. So that is why initially I said that is little serious about it.
So are there any different type of eating disorders that we need to know?
Yes, definitely there are a lot of different kind of eating disorders. One is anorexia nervosa. It is a kind of condition where that kind of patient will have a fear of eating, because if they eat, no, they will put on weight.
Okay.
And another condition that is called bulimia nervosa. In that condition, the person will eat more large quantity in one particular time, and the other time they will compensate it. They will compensate it.
Okay.
And there is another condition, night eating disorder. They will start eating only in the evening, and the whole night also they will eat. The whole day they will not eat.
Okay.
So it is another condition. Okay, and there is a condition called binge eating where they will eat more and they will not compensate also. And another condition is pika eating, that is nowhere related to the food at all. They will have mud, they will have ice, dirt, everything out of the psychological disorder. That kind of patient will have whatever they would like to have.
So out of curiosity, doctor, can these disorders be treated?
Yes, if you are getting treated with a proper psychiatrist, they need emotional bonding, they need support from the family, and at the same time, proper medications should be taken, and counseling, proper counseling they need, because out of unaware, they are not aware of the health issues what they are going to face out of this condition, and they wanted to be slim. That is their main motto.
Main motto.
So because of that, they are entering into these kind of improper diet pattern and ending up in this disorder.
Okay. Does people who binge eat also have the same kind of motto that they want? I mean, they don't have control of what they are eating, right? But will they have the tendency of like looking, I want to look slim?
Yes,
or
why binge eating patients they will do like that? Earlier they would have followed a separate diet pattern. They would have cut down, as I said, once in a while they will have either in the breakfast time or in the lunch time or in the dinner time, and once their mood swings are different, they will enter into this binge eating stage.
Okay, okay. So how do these eating disorders, you know, all manifest our food intake, weight management, posture, our behaviorals? So how does they impact all this?
See, because of external pressure only, they are more concentrated on this kind of food habits.
Okay.
Because they think, though they are damn lean, they will think they are overweight.
Okay.
And they will get into these kind of psychological issues. So that is why these people, particularly these kind of people, they might be lean only. They might be in the proper weight category, that is healthy weight category,
but
they think they are overweight, and they will get into these kind of activity and develop such disorders, and they think everybody are talking about their weight, their physical appearance. In that way they will get affected psychologically as well.
So among all these type of eating disorders, what I mean common people, what should they know about common eating disorders? Like, so not if all, at least few things people should be aware of.
Pica eating is the thing where people should be aware of, because many people do not know about it.
Okay.
That some people will eat mud, brick, this, that and all, they do not know. They should be aware of it. If someone does that, they definitely have to seek medical help.
Okay.
Psychiatric counseling is needed. Regular sittings are required for them to come out of it.
But what if we don't know if that person is undergoing that type of disorder?
That will lead to death only. Nobody can stop it. If
so serious problem.
Yes, the family members are aware of it, that is fine. If at all, definitely, I already told you the mortality rate is high with this
these disorders.
Okay, so definitely that will lead to death only. So we should be aware, the family members should be aware of that particular condition that person is going through, and they should seek a proper medical help to avoid that.
So, are there any conditions that triggers this behavior in the individuals?
Definitely, people with low self-esteem, they will tend to get this eating disorder, and people who have depression, anxiety, stress, even they will tend to get this eating disorder, and many psychological factors, like if they have a troubled relationship and the family members are not supportive, they will end up in these kind of eating disorders. And the conditions like where people have been cornered, bullied through their like the team members, or in college, school, wherever it is, they might end up in these kind of issues. These are all the factors which triggers them to get into this eating disorder.
So we can say that societal norms and cultural norms also will affect them?
Definitely, because they are not assessing their inner quality. Only with the outward appearance, people are being treated everywhere, right? So people who are less mature will tend to end up in this kind of eating disorder. The main motto is to reduce their weight.
Their weight, yes.
So they will think if they cut down the complete food, they will reduce their weight. But that is not actually going to happen.
Then I guess what we actually eat is more important than foregoing food?
See, we can go with a balanced diet. We can have all contents like certain grams of carbs, of fat, of protein, have plenty of water, keep yourself hydrated, more amount of fiber food. And if you really wanted to reduce your weight, you can approach healthcare center like us, Kolors. because we support with a passive therapy to reduce the weight with a balanced diet. So you need not starve, you need not end up in psychological disorder.
Yes.
A lot of advanced techniques have come now to reduce the weight. So they can approach us so that passively they can easily reduce their weight.
So are there any risk factors, when individual develop so vulnerable to this eating disorders?
Risk factors, they might end up in some psychological disorders, ADHD, OCD. These
Okay.
are all the psychological disorders where these kind of people, in a shorter while or long run, if they are continuing with the same, they might end up in these kind of uh, psychological disorders.
Psychological
Yes.
disorders. Yeah.
Are there any signs and symptoms for these eating disorders?
Yeah, you can easily find out from them. They'll feel always isolated and ashamed of their own body figure, and they remain hostile always. And their activities will be very slow compared to the normal person. They will concentrate more on they will think about their body, they will think about their figure, their weight. So and so, they will be more worried about their own body only. Yes. So they always feel isolated. So with that activities itself, we can easily rule out they are not in the normal form.
So there can be different reasons also, right, for being isolated. So
Ye-
those reasons can also lead to eating disorders.
Uh, no, eating disorders from other things, that is called depression eating. That is something different.
Different, completely different.
Yes, but this eating disorder is specifically people who wanted to reduce their weight.
Weight.
They will follow this pattern of diet, so that they wanted to look thin than others. That is their main
Okay.
thing.
So from a viewer point of view, I'm asking you this question. How can we differentiate a normal weight loss eating pattern or a potential or, disorder eating pattern?
Normal weight loss eating pattern, they will seek the advice from the registered dietitian.
Okay.
Their diet involves nutritious foods and it will be delicious, and they will feel more happy about what they are following it. And their energy levels will be always high,
Always
because
high,
they
okay.
don't starve for food. Their calorie content will be in a very balanced form, and at the same time they will follow some physical activity, or they will reach us to reduce their weight in that pattern. But the persons with eating disorders, they will not seek the help of others at all. They always feel isolated. They do their own ideas, they will inculcate their own ideas, they will follow what they are
They
right
want.
only. Yes, that is how we can easily differentiate people who are really on a healthy weight loss and the people who are on an unhealthy weight loss.
Okay. So from colors or from a doctor point of view, so you will be suggesting how the diet should be so that people should overcome or they avoid eating this type of eating disorders?
Yes, definitely. If a person is seeking our help to our dietist, we will suggest them, we will give them a counseling, and we will make them to understand the importance of healthy way of living, to have a balanced diet pattern, so that they will not starve and they will not end up in medical issues. They will not feel weak, depressed, stress, anxiety, whatever it is, they can easily overcome. So we will give counseling separately for it.
So counseling will be
Yes, definitely. Apart from diet plan, basic personal counseling is needed for them. So it is not only related to a physical disorder, they are mentally affected because of this kind of diet pattern.
So as you mentioned, counseling is important. So if you think a person is a normal person, but just
he want to maintain a healthy weight management or
Okay.
a healthy lifestyle. Even that person should undergo counseling.
General counseling is required for everybody because they should know in which cadre they are. Some person will be on a very basic BMI level high, not on the extreme BMI level high. Some people on the overweight cadre, some people on the obesity cadre, and the fat level, water level, basal metabolic rate. So certain things are there that we should be aware of ourselves. So a basic counseling will be given so that they will not end up in like more of stress because of the weight loss journey.
okay.
So everybody needs counseling, but people with eating disorder needs counseling frequently to come out of it.
So I have a condition, or I would like to know about it. So I know a friend of mine. So where she eats, stomach full in one time of a day, and she forgoes the other two times.
Okay.
So is that also a eating disorder?
It is a kind of eating disorder because, as I said, like bulimia nervosa, it is a condition where they will eat at a time. In one particular time, the more quantity they will eat. The other two meals they will compensate it. Yeah, that is also a kind of mentality what people will have. We can have more intake now. If I like one, like a sweet, say for example gulab jamun, if I like gulab jamun, I might have 10 pieces of gulab jamun at a time,
At a time.
and then I will think, okay, I will compensate in the next two meal, I will stay empty. That is not the case at all. If your stomach is empty, lot of acid secretion will happen in your intestine, and again that will end up in gastritis.
Okay,
So
yes.
that is how you need to balance the diet. You should know how to balance the diet. For that you can seek the help of the registered dietitian.
Okay. So at what stage you think, like seeking a help is important, or how can we identify that some other person is undergoing this type of eating disorders?
See, that is what they generally on their own, they will not approach the medical practitioner or the dietitian. Only the people around them
Around
can
them.
rule out, either the partner or the co-worker or the friend or gym mate, anybody they can rule out easily, so that they can help them to reach the medical practitioner. Because since we are discussing about this, many people are unaware of it. Maybe because of the discussion, some people might become aware of this condition. If someone is going around them is going through this kind of condition, they can take them to the nearest medical representative and get cleared of this.
So the major role here goes with our surroundings, you say.
Correct,
Supportive environment
correct.
or surrounding.
Correct.
Okay. So are there any strategies or methods to overcome this eating disorders with a balanced diet?
Yes, balanced diet is one particular thing where they can overcome this. But before that, they should be mentally stable to take up the balanced diet.
Okay.
So they should seek advice from the psychiatrist, and they can go to an occupational therapist to get occupied with the things what they like. Even they can go out to a grocery shop, they can shop something, they can keep occupied physically in the outer activities. Except the things which is happening inside the home, they can go out of the of their mental things, and they can get occupied with the other things.
So have you ever in your career met a person like eating disorders in your counseling sessions?
See, we do meet so many people every day, but 1 in 100 will have this eating disorder.
Okay.
Not all the person will have this eating disorder, but they will be treated personally. We will be taking care of them, and they can easily come out of this if they are coming for the frequent counseling session and following the balanced diet pattern.
So knowing Kolors Health Care, we know it very well for weight loss. So apart from this treatment, so how important, customers will get in maintaining their diet, or what are the precautions you follow? So knowing Kolors Health Care, so we know it for weight loss. So, but what is that you people make sure that it is a healthy weight loss apart from treatment, like giving diet or counseling them with a lifestyle habits? So what are the measures you people take?
See, apart from weight loss, when they are attaining their goal of that particular weight, it gives them confidence. They will get a positive mindset while reducing their weight, because they are coming back to their older shape, and the person will become more active, because the happy hormones will get secreted, the blood circulation will improve while doing activity. And we make sure that they have a proper rapport with us in future also. So along with the treatment, we will be giving them some free maintenance session in future. Say for example, for a year's time, for certain treatments we give 1 year of free maintenance. So they can come to us monthly once to have a body composition analysis checkup, to have a dietitian meetup, and to have a basic toning sessions as well. So in the future also, they will keep connected with us usually. So we will get to know their pros and cons in future. So if anything negative happens, if they are raising up with their weight, or if they feel like they are little down mentally regarding their diet pattern, they wanted to change their diet pattern also, our dietitians will help them out to modify the diet and come out of the stress.
So you
what
will
they
be
are
helping
undergoing.
out in and out of their diet also.
Yes, yes, correct.
Yeah.
So
So
we do have virtual consultations for
Oh,
diet as well.
really nice.
So if the person is not able to come directly to us to approach us, we can even take online consultations by helping them to get into a proper balanced diet sheet. That is a healthy way of living.
Nice. So finally, closing, doctor, what your suggestions or what are your tips for the people or for our viewers? I mean, and I mean, you know, they should know about this eating disorders, right? So this is very really people ignore it or even they don't know it. So what you'd like to say?
See, let them live happily. Let them not take things more stressful, thinking that this is wrong, this is right, to eat less is good, to to avoid that is good, like that. Because now we are already we are into a sedentary lifestyle only.
Yes.
We have to balance our diet. So as a regular master health checkup, everybody goes for a master health checkup when we are 35 plus
Yes,
years.
yes.
Likewise, a personal diet counseling is required for everybody. Even at the age of 10, even at the age of 15, you can go, age of
So
20 or at the
irrespective of
60.
all ages.
Yes, you can just seek a dietitian help monthly once or 6 months once. Even you can get a diet plan, you can modify it. Nowadays, everything is available in online.
Exactly.
So we can seek the help of the dietitian over online also. So that will be more helpful for them to avoid these kind of psychological disorders.
So to an extension of this conversation, as you said, everything is available online. So how is that different from coming to a doctor?
See, online consultation with the dietitian is different. Online acquiring diet sheet is different. You can acquire diet sheet from online personally by typing your age, say for example your
Yes,
height,
all
your
details,
weight,
height,
everything.
weight,
When
everything.
you enter the diet chart, you can download it. That is not the proper like customized diet chart. If you have a consultation with them, even virtually or personally, like physically, you can tell the pros and cons of your work style. You might be in the night shift, you might be in the day shift, the school timings will be different, the college timings, the eating time will differ from person
Exactly.
to person. So those things we cannot discuss through Google or through a Google form. We cannot fill that and send it to a person, right?
Yes.
So rather going to a ready-made diet consultation or diet chart downloading, you can meet a dietitian either to their own clinic or online. You can approach them. That is not the thing. But first have a counseling with them. Tell all your availability, likes, dislikes, whatever you find easy to get it. And people from US also can get a diet consultation
Diet
from
consultation,
the dietitian.
yes.
People from India can also get a diet consultation, but we do not know what is available there. So after telling the details in depth only, the dietitian can frame a diet chart, can customize a diet chart. So that should be in a nutritious way as well. The calories will get calculated. They will calculate the calories, how much proteins, how much carbs, how much fat and all. But so my suggestion is, don't go for a easy way of easy way of getting prepared. We cannot easily cook everything, right?
Yes,
Ready-made,
yes.
nowadays
Everyone wants it like this.
Yes. So that cannot happen when it is more concerned about our health. Health
Exactly.
is more important because we are living here, we are earning, we are doing certain things only to have a healthy lifestyle. That is what.
Yeah. So at the end, what we say is happy life is most important.
Yes, correct.
Yes. Thank you, doctor. Thank you so much.
Thank you so much.